So, hello everyone. It's a great pleasure to be here with you and interacting. Uh, Today, the subject of discussion is how to write a case report. So, why are Indian doctors globally so famous? And one of the reasons is that the doctors have an opportunity to see so many different patients in a day because of the large population that we have. Every doctor is pretty busy in finding out different patients, the illnesses, the signs, symptoms, and try to treat them accordingly. And the knowledge and the experience that they have is perhaps not matched by anybody else in the Western world. But the only thing that probably we lack is the documentation and effective communication of the patients that we see all the time. For instance, simple cases like fever have different kind of symptoms and the signs, and we can have diagnosis, various diagnoses depending on the investigation that we do. It could be as simple as malaria, dengue, typhoid, and it could be very complex or very rare problems that we see during fever. And during this COVID-19 times, we have seen in this pandemic various different ways the disease can show itself and manifest itself. And that is the reason that we need to actually document. And that is perhaps the only weakness that the Indian doctors have. And slowly, because of the mobile, the technological advances, we are also getting towards the Western countries' doctors and finding out and letting them know the different kinds of diseases and the patterns. And so let us come to the direct topic of writing the case report. Next, please. Why do we require to give a case report? A case report, the aim of this is that to convey a clinical message. What is it that is something different in this case, or what is it that we need to find out? And this documentation will extremely important in future because what we see in different diseases that it has to be recorded, and we see different variations in different kind of situations. And that's the reason why we have to also find out certain syndromes that are present. Sometimes they are very rare, and sometimes they are endemic too. So we will be talking about it little in further slides. So second is enhance the reader's knowledge on the clinical manifestation. There are certain problems and diseases which are extremely common, which are seen in various places, whether it is Maharashtra, Gujarat, North, South, anywhere. But at the same time, there are certain problems which are present exclusive to those regions, and that's the reason why we have to find out. For instance, we see chlorosis much more common in the desert area or Kutch, which is not so commonly seen in Mumbai or other metropolis. So we have to show the readers that these fluorosis could occur in certain problems and certain endemic situations. Again, the case report also aims to deduce the diagnostic approach with a focus on imaging modalities for case reports published in medical imaging, radiology journals, or the therapeutic alternatives of the disease. Now, for instance, in orthopedics, there are certain deformities which are present at the time of birth, they are present later on over a period of time. So sometimes it is also occupational related too. So we have to find out whether if these deformities are seen commonly, something like we see deformities because of the rickets or certain other metabolic problems. So there are some certain common problems which are seen, but there are certain problems like osteopetrosis or fibrodysplasia, etc. So those are unusual problems, but which needs to be noted down, tell the radiological features, the imaging modalities, etc., and tell them the different kinds of deformity that can occur. Next, what is a clinical case report? Now, first of all, we must find out what do you mean exactly by a clinical case report. A case report is a detailed report of symptoms, signs, diagnosis, which includes investigations also, and the management of the treatment and the follow-up of an individual patient. And this is extremely important that we have to have all those details in a minute or very, very micro details which needs to be given in the case report, because that is going to make us diagnose the problem and also treat it accordingly. An unusual or a novel occurrence, and as such remain one of the cornerstones of medical progress and provide many new ideas. Because what is so unusual in that particular case, that is what we have to actually find out, whether is the appearance, whether there are some skin rashes along with it, there are certain problems which are accompanied with it, and sometimes there are combinations of problems that we see in a rare case. And at the same time, all this has to be in a rapid, short communication. We are not going to write a thesis, we are not going to write a book or a chapter on it, but it is in the short, maybe 3-4 pages, full-scape papers that we need to give a clinical case report, which has to be appropriately described and has to be produced. Then let's come to next, please. So then, common reasons for publishing a case report. What are the common reasons? Why should we publish at all? An unexpected association between disease or symptoms, and that is very important that we have to find out if a disease or a combination of disease. Sometimes a patient comes with a foot drop, and at the same time we don't know whether he has a skin problem like leprosy, or sometimes there is a problem at the spine when there is a root compression. So simple thing like a foot drop can also have a combination of leprosy along with spinal problem. So this is what is an unexpected association between the problem that patient has and the symptoms and probable etiology. An unexpected event in the course observing or treating a patient. Sometimes we give a patient certain medication, and which after 24 hours or maybe 48 hours, patient starts feeling dizzy, he starts feeling very sleepy, sometimes there is a vertigo. So we have to find out whether it is related to the medicines that we have given or it is part of the progression of the disease. So that is what needs to be seen. Sometimes it is a combination of both too. So unless we know whether this particular medicine can give rise to some kind of adverse reaction, or sometimes it's just a progression that we have to find out, and this is an unexpected event which needs to be dotted or jotted down. Findings that shed new light on the possible pathogenesis of a disease or an adverse effect. That's what I told, that sometimes we give certain medication and patient over a period of time starts getting some itching on the skin. Sometimes there are some pustules which appearance. Now this is exactly what happens in the herpes, that sometimes the pain precedes the possible appearance of these pustules which are there, which are herpes which are seen, but then this could start after giving the medication. So sometimes we can think that it is the medicines which have given rise to this itching, or sometimes pustules. So this is what we have to find out, the natural progression of the disease or the adverse reaction of the medicine that we give. So this is also has to be noted down, that we can have a certain problem because the medicine itself or the disease. Unique or a rare feature of a disease. Now sometimes we can find out a combination of disease or a syndromes that are there which are extremely rare, and that's what I told in the beginning, the fluorosis which is common in the desert area, which is not so common in the metropolis. Similarly, in orthopedics we have some deltoid contractures, or sometimes we have some cordyceps contracture, which is very, very common in the areas in the eastern part of India where they have a system of giving IV fluids in the thigh, and that can give rise to contractures later, which is unusual in the metropolis or in the tier 1 cities. So this is what we have to find out. This rarity is because of the way of these medicines which are given. Then unique therapeutic approaches, variations and anatomical structures. Now there are certain anatomical structures which are varying in very many individuals, and that we have to find out. I remember one instance when we were doing the residency. where we had to do a tenotomy. The senior person who did a tenotomy and accidentally cut the artery, which was not, fortunately, not a dangerous, but it was the artery which was cut while doing the tenotomy. And when we actually found out later on, there was a anatomical variation of that artery which was not supposed to be there at the place where the tendon was there. So this can happen the rare, and this case of course was represented, was reported, and actually gave us insight into people who did this tenotomy later on, and we have to be careful about finding out whether these anatomical variations are there. And this can happen also many times when people are having a facial nerve palsy, when people actually operate at the parotid tumors, etc., when they find out that the facial nerve can get injured if there are anomalous facial nerve distribution. But these are the anatomical structures which are sometimes variation in this, and that we have to find out. Next, please. So now, in the skeleton of a case report, it is very important that we find out and we do write down the abstract, the introduction, the case presentation, the discussion, and finally the conclusion, which needs to be written. And this is what very important. This is a perfect way the case report has to be represented. And this is what I'm going to talk about in a separate manner. Next. So in the abstract, it is important, very important, this abstract, which actually is eye-catching. This should not be longer than 100 to 200 words. So basically is the short form of the whole paper that you are going to write down the case. So it should also generate an interest of people to write down whole about the case. What is so unusual about it? Why it was written in the first place, and something which is not seen in our area. It should highlight all our key points concisely, and that is very important. Brevity is very important in abstract, so it should not be written as a thesis. It should be written in a short form, and that's why most of the times 200 words is the maximum that you should use. It needs a special care as it will be used to judge whether your case is accepted for presentation or publication, because it should generate an interest in public. So when we write down abstract, it should be actually accepted by the journal or people who matter. Though an abstract goes first for submission in journal, it is best to write it after you have completed the case. Basically, you have to keep the whole case report ready and go again and again through that case report and make an abstract which is pertinent, and very important points about this case report should be highlighted in the abstract, and this is important. So abstract is extremely important. It is probably the heart of the whole case which needs to be thought of. So we give ample time to writing abstract after your case report has been thought about. Next, please. So in the introduction, this introduction also should be concise, and it has to give a salient features and immediately attract the attention and interest of the reader. So introduction, supposing we say that we have seen cysticercosis. Now cysticercosis now is commonly seen in many people. It is not necessary that only non-vegetarians have this cysticercosis, but we have also seen those people who are vegetarian, they eat salads only, but if they are not washed properly, can land up with cysticercosis. Now, cysticercosis is very commonly seen, but if you see it in a rare area where it is not normally seen, then it actually attracts the attention of the reader. That is what is important. Sometimes you see a hydatid cyst. Now, hydatid cyst also, there are plenty of cases which have been reported. But if you see an unusual place where hydatid cyst is seen, the hydatid cyst in the bone or spine or something, so these are very unusual representation of hydatid cyst. Now, this is very important. So if you write down in the beginning the salient features and attractive features of this case, it attracts attention of the reader as well as people who actually matter in selection of this case report, and provide the subject, purpose, and the merit of the case report. And this is again important. Why we are doing this? What is the subject that we are talking about? Why are we publishing this first of all because it is something unusual. Now, just for an example, since COVID-19, which was found out in Wuhan in 2019 November, we have got a spate of papers which have come, published papers, which are more than 5,000. And in this, every day they have found out something different. Now, for instance, now we have realized all those people have gotten well, they have gone home, they have started normal life, and again, after 3 weeks, 4 weeks, 5 weeks, they have come back again with a pulmonary fibrosis. Now, this is an unusual presentation which people thought that after they have got antibodies and they are probably cured for life. That is not the situation. We have also realized the antibodies that are produced after this illness, these antibodies disappear after 3 months. So these are newer and newer ways finding out, and this needs to be reported because the next person who's going to treat this patient should not make the same mistake that the previous doctor has done. We have to also have a comprehensive literature review that support the case report, and this is very important that we have to find out the literature, because something which you have found out for the first time, if you go for the literature, you will realize there are thousands of other similar cases in different areas which are there. So there is nothing novel or new about that case. So I mean, the whole purpose of writing this case report goes because of the very commonly that case is seen. So we have to have a comprehensive literature review. Fortunately, we have so many PubMeds, we can do a Google search, etc. And we have various different sites where we can do a literature review to find out whether this case is unusual, whether it needs to be reported first of all or not. For instance, um, and sometimes what we think is common is rare. I remember a case of a cyst which turned out to be giant cell tumor of the distal phalanx of the toe. And I found out in the literature review that there was no other case which was reported in the literature. Immediately I sent it to the journal and I could publish that as the first case reported in the journal. That was long back. A brief 1 or 2 sentence description of the patient case should be provided. And that is very important. Again, we should be able to concise the whole description. Sometimes unwanted description of the disease need not be given. Supposing patient has put on weight along with the disease itself. Now that putting on weight in last 6 months, 2-3 kilos doesn't really matter. It has nothing to do with the specific problem that patient has. So that should be avoided and something should be provided. Supposing he has itching along with some swelling, that needs to be provided, and that is extremely important. Next please. So after introduction, there are certain things that you should not miss at all. The literature search should provide enough detail for the reader to easily reproduce the search. So that is again important, that we have to give you details to the readers that they can actually reproduce the search. So there are certain key points that needs to be given in this case report which reader can easily search. The database that are commonly searched, these are the two databases which are commonly searched, but of course there are plenty of other links also they are known. Medline is the US National Library Medicine NLM premier bibliographic database, and this is very, very important and extremely important, especially all kinds of, we have thousands and thousands and lakhs of reports that are there, and we should actually find out from this. The search of this link is extremely important. Similarly, AIM base also is very important. Use the latest differences. Now again, this is an extremely important because diseases keep on modifying. Sometimes newer researches are given, sometimes newer medicines are also produced, newer investigations are there. So all these are very important. So 10 years ago or 15 years ago, if you have certain information, if you see the latest, the last year or this year's references, that will add to your knowledge, and that will also give you an insight into how this disease could have been investigated and found out clinically, and that is very important. So we should not miss the latest references and latest links. Next please. So now I'll give you an example. Case should be having a patient description. That is very important. In the patient description, his name, age, sex, occupation, and also where he is coming from. As I told you, there are certain diseases which are endemically present, and we have to find out. For instance, giant cell tumor is very common on the eastern side of India. This is very important. So, patient where he comes from, also his religion. For instance, we find out because of this burqa, burqas, ladies in the Muslim community, they have osteoporosis or they have certain osteomalacia also. So this has to be found out. The religion is important. In the case history, we have to find out his personal habits like smoking, drinking, sometimes if he has taken some drugs in the past, if his history gives some adverse drug reaction. So these are very important pointers to the patient, whether it's a common problem or it's a rare problem. The physical examination also should be extremely in detail. That includes his height, weight, pulse, blood pressure, etc. Now coming to the pulse, now one person did not have a pulse on the right side at all. One should not get panicky because it could be anomalous artery, radial artery that he has. Sometimes there are certain subclavian stenosis, etc., which can give rise to ectopic beats. So this physical examination is very important and should be given in details. Now, results of the pathological tests and other investigation. Now, there is no doubt all these investigations which are relevant to that problem that patient has should be given in detail. Now, there is no reason for giving some, supposing somebody is 12-year-old, there is no reason if he doesn't have any cardiac issues, no need to do any 2D echo or ECG, etc., which is not relevant. So, we should not even do this investigation and should not write in the case papers. Similarly, after doing all this, we have to find out how we are going to manage this patient. And this is extremely important. We need to come to some kind of clinical diagnosis, confirm your diagnosis with the investigations which are relevant. Sometimes there are differential diagnoses which are there. So we have to find out which is the most possible diagnosis in that particular cases and what was the treatment plan and what was thought about and what was the treatment which was given. And this is very important because the expected outcome of the treatment plan is sometimes very important. And if it is not the expected outcome, then why this has happened and why the expected outcome was not there, we have to find out whether basic, again we go back to finding out whether your diagnosis was wrong or whether the investigations what we did was wrong. Many times there is a chest pain. Now this chest pain could be related to the heart, it could be related to lungs, it could be related to your neck pain or a radiculopathy. So all these has to be, supposing he doesn't get well with the treatment of the neck radiculopathy, then we have to find out whether there was any lung problem and we have to go back and find out whether there are any anomalous problem in that particular case. And again, at the end of this treatment plan or whatever the treatment was given, what was the actual outcome? And this needs to be again given in detail, whether this is what was expected, this is what was given the treatment, and this is what found out. So the case is presented in the chronological order and in enough detail. The details are very important, especially when you are writing a case paper and when it is given. Next, please. So I will give you an example of a case. How do we write and how does the patient present? A 33-year-old male was admitted to the outpatient department due to an increasing lump on the right thigh, which he stated as having been present for 5 years. There was a painful feeling in the right upper leg occasionally. There was no complaint of lower limb weakness, no history of trauma, and the patient was otherwise in good health. On physical examination, a deep-seated round mass was detected and located on the right thigh, which was front of the thigh, in the middle thigh, with a size of 25 by 25 by 15 centimeter, showing hard consistency and non-mobile features. And after looking at this, we will think about some lipoma maybe, it could be something to do with the muscle mass, etc. But one thing was unusual in this case. When we put the stethoscope on that mass, there was a very noticeable bruit, which is very common with aneurysm. And this is what we found out. And this is something unexpected in certain case like this. And we found out there was a femoral aneurysm and that needed operation, and which was very important because a vascular surgeon had to be involved in this. So this is something which is rare, which needs to be noted. This is not, this is out of the blue that we found. So simple thing, we palpate the thing, we actually feel, we see what is the problem. We also do auscultation, and this is important. And this is what was done in this particular case. And we probably saw that there was no catastrophe which occurred, because if somebody thought that it could be abscess, there was nothing else was done. Of course, then later on, CT scan, MRI, all those investigations was done, angiogram was done, arteriogram was done, and then this was successfully operated. Next, please. So again, all important negative findings also should be provided. Supposing this swelling which we have seen, we have to also write down there was no other similar swelling which was seen in the body, because sometimes we find one some swelling at one time. When we see other places also, we see the similar kind of thing, something like in neurofibromatosis or lipomatosis, we see similar kind of swelling which could be there. So we have to also give a negative finding, which are extremely important in certain cases. The author's own interpretation or inference should be avoided in the body of a case report, because see, many times we are biased because we have actually seen the patient, and that's why the author's interpretation is important, of course, but we should not think, because we have already done the stethoscope examination and we know that this was a bruit, this was something like a aneurysm, and this reference should be avoided in the body of a case report. Tables, figures should be used to reveal chronological findings or to compare observations using different methods. Now again, tables, supposing what was seen on the day one when we saw the patient, maybe after 3 weeks what was seen, what after 6 weeks what was seen. Supposing the patient had come with a fever on the first day, after 3 weeks this fever had subsided, the swelling has increased, and certain figures, and nowadays it becomes very easy for the mobile to take some snapshots, and that becomes very easy to find out the chronological progression of this problem. And we have to also do this regularly to find out whether there is a progress, whether there is a regression, whether there needs to be done something acutely or not. So these are very important. So tables, as whenever possible, sometimes pie diagrams could be given, sometimes other graphs could be given. We can also show these figures and also line drawings, which will help in the case report, which adds to the beauty of this paper. Figures and tables should have brief description and cited within the text. So we should write down below those figures and tables what this is representing, and in the paper itself we should write down, we can refer to that figure or a table so that we can increase our knowledge. Next, please. Okay. So as I told, patient's demographic history, in which age, height, weight, sex, race, occupation has to be included, and I have given you ample reasons for it. Patient's medication history is extremely important to find out whether he is allergic to anything. Patient had good, uneventful taking medicines, medication history, and it should include the medication name, the strength of that medication, the dosage form, the route, and the dates of administration and for how long it was given. If the brand name is relevant in that particular case, because sometimes there is a combination of drugs, it can be mentioned. The patient's laboratory and diagnostic data is very, very important in case reports. The patient's laboratory values and diagnostic data which support the case and rule out a differential diagnosis should be mentioned. Pertinent positives or negative laboratory results must be provided. When the reference range of a laboratory value is not widely known or established, it should be provided in the parentheses. So we have to sometimes patients themselves do some examination, some investigations themselves, which are absolutely not relevant to the patient, because many times they have an access to the pathology lab and they do sometimes very stupid investigation, I must say, and those are absolutely irrelevant. And nowadays we see, because sometimes these laboratories do give a complete checkup at a concessional rate. So they tend to do the all the tests, and sometimes they are confusing. Sometimes some reports which are something like a SGOT, SGPT, they are raised, and that confuses the whole thing. First of all, they were not relevant to this disease investigation to finding out the diagnosis, and this can actually confuse you. So don't do irrelevant investigations, and it should not be actually given much importance. The diagnostic procedures, the timeline in which they were administered, and the brief report of the result should be included. Sometimes there is an aspiration which is done, some kind of biopsy which is done, which are very, very important because that really adds value. Something which is thought like a malignant could turn out to be benign and vice versa. So we have to find out the diagnostic procedures and they have to be mentioned. Next, please. And now finally the discussion. Now that discussion is also as important as the beginning, the introduction. It should evaluate the patient's case for accuracy, validity and uniqueness, compare and contrast the case report with the published literature. And this is actually the crux. Discussion and finally the conclusion should be the crux, which will actually give us the insight into why this case has been presented here, or case report is very important. Whether it is absolutely rare, sometimes rare, or or it is very common, but it is not usually seen. Sometimes some diseases which are seen, something like a bubonic plague, or sometimes there are some sarcosis syndrome, Kaposis syndrome, which is seen, which is not here at all, or which was seen 20, 30 years ago, which are again seen. So this is unique in that particular patient, which actually can be published and shown. Briefly summarize the published literature derived from the literature. Again, we have to also give to substantiate our case reports. We have to give a literature review, and that is important. So all the references cited should be critically evaluated, because many times even these references cannot be actually pertaining to that case at all. So we have to find out whether it is important. Sometimes now some general practitioners, even simple things like fever, etc., they have been able to diagnose whether it was sarcoidosis, whether it was brucellosis, something rare. And that is very important because we are very analytical. We have to analyze those problems. We have seen that there is something different in that particular fever, and they have been able to analyze. So that's why this is a very good way to update your knowledge, attend some CMEs, attend some workshops or conferences to upgrade the knowledge. And that's why we find out, because the disease are modifying, there are certain occupational problems which are also included in problems which are modifying the diseases. And there are references to be in the Vancouver style. And this is how we have to give the references. They are important. And that is how this Vancouver style gives you how the references should be given. And this is how you should list them. And finally, I have to tell you in conclusion, which is not given in this, but conclusion should be also given, that this is a case which has been shown because it's unusual for the reasons that we have seen, because these investigations were not showing that this was the problem, but finally we found this. And many times there are complex issues, as I told you, combinations of diseases which are rarely seen in the area where you practice, and this needs to be addressed and this has to be reported. So friends, this is in nutshell that I've talked about today. Next please, about how you have to write a case report. And this is very important, not only to upgrade your knowledge, to have it, make it interesting, the practice, because you see the similar kind of patient day in and day out. But if you, once in a month or twice in a month, if you see unusual case, then it provides you an opportunity to read up, to update your knowledge, and also share your knowledge with your colleagues and write down in the journal, so that it gives you some kind of challenging situation. It also gives you some kind of high. You have a satisfaction that you have found out something rare, and you again dissipate their knowledge to your colleagues. So friends, this is important, that even in general practice, it is very, very important to be extremely observant, analytical, be logical, and find out and how can you make the patient best. So finally, it is in the interest of the patient that you have been able to treat that at your level. Thank you very much again. We'll be again meeting you in the further talks that I will be giving in future. Thank you.